Hi, my name is Pam Hastings. I'm one of the lactation consultants here at Riverside Community Hospital. I've been fortunate enough to be here for about 20 years, mostly in lactation, but also as a bedside nurse. Today I would just like to talk a little bit about breastfeeding basics. How do we know that our babies are transferring well? How do we get a comfortable latch with a new baby? First of all, I'm going to grab my pillow here, because you want to make sure, mommy, that you're comfortable. And I'm going to show you a few holds that I think are especially important for a newborn baby. Mommies, we always want to make sure that the baby is totally facing you. And I'm going to show you a cross clutch hold and why I think this hold is an important hold and is easy to do for a new baby. All right, so moms, make sure that you're comfortable. If you've got a comfortable pillow that you like to use, maybe you've got a special boppy pillow for your baby, whatever's comfortable for you. But when you're breastfeeding a brand new baby, I think these two holds that I'm going to share with you are very important. Always make sure that your baby is facing you. When you hold your baby in the cross clutch hold, you're going to hold the baby's weight under your forearm and hold your baby right here on the shoulders. With your other hand, if you put your thumb opposite the baby's nose, that always shapes the breast in the shape of the baby's mouth. Tickle the baby's lips with the nipple until the baby opens wide. And when the baby does, bring the baby quickly and closely right onto the breast. That initial latch, the baby is pulling the nipple to the back of his mouth. But after that, moms, you should feel a comfortable tugging. If it's hurting, please let us know. That is not normal. Another hold that I think is helpful for a newborn baby is called a football hold. This hold is good if you've got a premature baby. It's also, I think, helpful if you have a C-section. It keeps the baby's weight off your tender belly. So again, you want to make sure that the baby is totally facing you. Support the baby again with your forearm. Hold the baby right here on the shoulders. We don't want to hold the baby on the head, and we don't want to be pushing on the head. Babies don't appreciate that. So just try to hold your baby right here on the shoulders. Also, it's important to hold the baby on the shoulders because remember, a good latch starts with the baby bringing her head back. Baby should lead to the breast with the chin. So again, I'm going to place my thumb opposite the baby's nose, and I will always shape the breast in the shape of the baby's mouth. We know the benefits of breastfeeding for our moms and our babies, families and communities. But for our babies, every organ system in the baby's body develops differently on mother's milk. Especially the baby's brain growth, the baby's gut. We know that's where most of our immunity comes from, is from our GI tract. But for our moms as well, certain cancers for moms and for babies, heart disease, diabetes, high blood pressure are certainly chronic diseases that we all have family members that certainly have some of those diseases. There are many chronic diseases that we know breastfeeding is beneficial. Heart disease, high blood pressure, diabetes, obesity, child spacing. Here at Riverside Community Hospital, we're very proud to be designated a baby-friendly hospital. That means that our family birthplace, our nurses, our physicians have had training in lactation management. We support all of our families, regardless of their feeding choice. Here at Riverside Community Hospital, we're proud to be designated a baby-friendly hospital. Our staff, our physicians, have all had training in lactation management. We support all of our families regardless of feeding choice. At birth, moms, your baby's going to be placed skin to skin right here on your chest. This is such a special time for you and for your baby. Some of the benefits of skin to skin for your baby is stabilizes your baby's temperature, heart rate, breathing. It can also help stabilize baby's blood sugar. Frequently, I'm asked, what can I eat, what can I drink to make more milk? The key to making milk is the empty breast. Moms, eat and drink what you like. Make sure that you drink to thirst. But the key, again, is emptying the breast. I'm going to show you an easy tool called hand expression or manual expressing. You'll see here at Riverside Community Hospital, we are wanting all of our moms to learn how to hand express. It's quite easy to do, but it's a very important skill. Again, it will help you make more milk quicker for your baby. Place your hand in a C hold, and I usually go past the areola, but you can see I've got my thumb and fingers opposite the nipple. I'm going to press back to the chest wall, and then I'm just going to rotate my fingers, keeping my fingers in the same spot. I think of this as press, compress, press, compress. I'm really trying to gather that inner breast tissue. So moms, try to keep your baby skin to skin on your chest as much as you can. It's not just for feeding, but when your baby is skin to skin, you'll make more milk. Your milk is higher in antibodies. You'll be able to see those feeding cues, any mouthing, bringing the fist to the mouth, even tongue sucking. The very best feeding cue is when the baby's face is quiet, but you can see the baby's moving his eyes, that rapid eye movement. When you have your baby here skin to skin, the baby doesn't have to go far because our babies go through those sleep states very quickly. The diaper change can wait until after the feeding. So when you see any of those feeding cues, mom, when you have your baby right here on your chest, just let your baby decide which breast the baby's gonna go to. A healthy full-term baby really knows how to find the breast, how to latch, and how to transfer. Ideally, you're looking for 8 or more feedings every 24 hours. The first 24 hours, that can be challenging. Just like you're exhausted, your baby's exhausted also. The second and the third 24 hours, now your baby's going to be much more awake, maybe a little fussy. Remember, those behaviors are about getting more milk. That is normal, expected newborn behaviors. So when that happens, mom, just keep offering the breast. Remember, the more the baby is at the breast, the more the baby takes the milk from the breast, the more milk you're going to have for your baby. So we've already said we're going to feed our babies on demand. Our goal is 8 or more feedings every 24 hours. For our diapers, we're looking for 1 pee diaper, 1 poo the first 24 hours of life. We're looking for 2 pees, 2 poos the second 24 hours of life. 3 of each on day 3, and then after that your baby should be having 6 to 8 pee and poo diapers every 24 hours. Please make sure that you follow up with your pediatrician 1-2 days after hospital discharge. Frequently, families are worried that the new baby is not getting enough to eat. Your baby's tummy size is about the size of a marble or a cherry and holds about a spoonful of colostrum. That's the first milk that you have in your breast. Very important signs of milk transfer for a new baby. We want to see the baby sucking very regularly. Baby may suck 6-8 times a pause and a swallow, but a feeding is generally 10, 15, 20 minutes of active sucking and swallowing. Please pay attention to swallowing. It sounds like an exhale, like a Sometimes when you hold the baby on the shoulders, you can feel that. Sometimes you can hear it, sometimes you can see it. But please keep an accurate record of how many feedings your baby has that first week and also those pee and poo diapers. After about the first 24 to 48 hours, you'll notice that your baby's poo is going to start changing color. It's usually very dark, very sticky, what we call meconium, but we want to see that stool start to thin out a little bit and start to change color by about 48 hours of age. Here at Riverside Community Hospital, we encourage our mothers to hand express and spoon feed colostrum. It's quite simple to do and very effective. Remember, when you take the milk from the breast, that will help you make more milk. And it's a perfect supplement for your baby. We give that with a little cup or a little spoon. Moms, when you come in and that's your goal to breastfeed, that is certainly our goal, is that you go home breastfeeding confident in your breastfeeding with an early follow-up with your pediatrician.